Hi, my name is Ashlyn, and today I'm going to be discussing contraceptives and their use. So, if you've been keeping up with the news, it is likely that you've heard about the government changes relating to the overturning of Roe v. Wade, which is a constitutional amendment which legalizes abortions. With this overturning of Roe v. Wade, it is especially important for people to understand all the different contraceptives and their uses in order to prevent pregnancy, which may be soon diminished due to this overturning of this amendment. I am soon starting nursing school, which I'm super excited about, and I'm super passionate about reproductive health and ways that we can better take care of ourselves. I have taken numerous classes that cover topics relating to this, so I feel very well educated in this subject. First, we will be discussing the many contraceptives that are available and how effective they are in use. Starting off with contraceptives available to people with uteruses. First off, we have the intrauterine device, also known as the IUD. This comes in either a copper or hormonal version. They look something like this. They're just inserted into the uterus and they can be left there for anywhere from like 3 to 10 years. According to the CDC, they both have less than a 0.8 failure rate, which is super impressive compared to lots of other birth control options. Next off, we have a birth control known as the implant or Nexplanon. This is inserted into the upper arm. It's just about a few inches long, and this can be left there for up to 3 years. According to Planned Parenthood, the IUD and implant are the most expensive temporary birth control options. For some, they can cost up to $1,300, which is definitely not in some people's price range. Another type of birth control available is the injection or depot shot, which is given in the upper arm or butt about every 3 months. This has a 4% failure rate, which is still awesome. The most common oral contraceptive that is used is known as, or excuse me, the most common contraceptive used is the oral contraceptive, also known as the pill. This can either be progesterone or estrogen and progesterone combined. Both of these have about a 7% failure rate. This is super accessible for people to use, so that's why it is the most common. The patch is another type of birth control. This is worn on the arm, abdomen, butt, or other upper body region typically, and this is good for about 3 weeks and replaced. This is a 7% failure rate. Another type of birth control used is a hormonal vaginal contraceptive ring, also known as the NuvaRing. This is inserted into the vaginal canal and it sits right underneath the cervix, releasing hormones that prevent pregnancy. It is good for about 3 weeks and then it needs to be removed and replaced. All of these are great tools for preventing pregnancy, but none prevent STDs from occurring. So now we'll be talking about more barrier methods, which can both help prevent STDs and pregnancy in certain circumstances. One barrier method is known as a diaphragm or cervical cap. This method covers the cervix in order to prevent sperm from entering the uterus. It's about 17% effective, which is not great compared to others, but it's still a great option for people who want to use it. Another option is called the sponge. This has quite a large failure rate range, anywhere from 14 to 27%, but this also just helps to block sperm from entering the uterus. Next, the male and female condom are both used to prevent STDs and pregnancy. They're both great options. However, the male condom is slightly more effective with only a 13% failure rate, whereas the female condom has a 21% failure rate. Spermicides can also be used alongside these birth control options to kill sperm before they are able to enter the uterus and fertilize the egg. This has about a 21% failure rate on its own. Another type of pregnancy birth control is the fertility awareness method, which is used by tracking the menstrual cycle to help know when a person is most fertile and to avoid sex during those times. However, the most effective birth control that can be used is female sterilization and male male sterilization, which both help to prevent eggs and sperms from being released from their places within the body to stop pregnancy altogether. This is a surgical procedure, either the male vasectomy or the female tube ties. This is not for everybody, but it's a great option for people, especially when they know that they are done having children, if that's something they want. Overall, the FDA suggests that you think about your health, access to different types of birth control, age, lifestyle, whether you want children, how many sexual partners you have, and as many different factors that you can look at. There's no one size fits all solution for everybody, so it's important to look at all these different factors to determine what's best for you. All in all, there are a ton of different ways to prevent pregnancy, and it's important to know your options if you are someone if you or someone that you are having sex with is at risk of getting pregnant and does not want to be. Reliable resources such as the CDC, Planned Parenthood, and the FDA all provide guidelines of what may be most suitable for your lifestyle. It is always important to determine what's best for you and talk to a doctor if you have any questions. Thank you so much for listening, and I hope you have a great rest of your day.